I think a number of you are acquainted with Dr. Hostetter. I first met him when he came to Goshen in 1999 to be the first medical director of the Center for Cancer Care at Goshen Health System. Some of us also knew of him as the son of B. Charles Hostetter, the speaker for many years on the radio broadcast, The Minute Hour. Just a few things from his resume. Dr. Hostetter is a graduate of Eastern Mennonite University College at that time, and he was a member of the All-Conference soccer team. He attended Medical College of Virginia in Richmond, Virginia, did a surgery residency at the University of Health Sciences, Chicago Medical School, and at the University of Texas. He had a fellowship in general surgery at MD Anderson Cancer Center and a fellowship in surgical oncology at Memorial Sloan Kettering Cancer Center in New York. He was the director of surgical oncology at Mary Babb Randolph Cancer Center at West Virginia University, where he was also an assistant professor until coming to Goshen to be the medical director of our new Center for Cancer Care. Since then, he's been a surgical oncologist with Goshen Health System. He's been a clinical assistant professor of surgery with Indiana University School of Medicine. In January this year, he accepted the role of interim health officer, Elkhart County Health Department, and he's agreed to share something of his experience. We, as a committee, paired this in August. We heard Susan Pranger, who is the vice president at the Goshen Health, share some of the learnings from their latest community health needs assessment. And we thought today we would invite Dr. Hostetter to share his perspective on health challenges of our community from the perspective of our county health officer. So Dr. Hostetter or Rick, welcome to our class.
Thank you. It's a pleasure to be here, and to say that I feel like a fish out of water would be an understatement, because I had very little training in public health medicine. In fact, the last time I had it was in my first year of medical school, and it was quite limited. But I have spent a good bit of my career doing third world short stints, and having grown up a missionary kid for 5 years in Africa, have a passion for serving the underserved, and that's what our public health department does for the most part. We also did a community assessment as part of our ongoing work at the health department. We do that every 3 years. I wasn't prepared to come and share on that necessarily, but at the end I'll touch at least on where we see our priorities are. But I did want to share with you some of my perspectives on what I've observed, and this has been a steep learning curve for me. I knew very little about what took place in the health department, despite the fact that I've practiced medicine in this community for 20-some years. I still had very little understanding. So I'm gonna assume that you have that same little bit of understanding that I did, but I'm sure many of you here actually probably could have given this talk better than I could. But let me start with, our motto, or our mission statement that we share before our meetings is that our work is to educate, to protect, and improve the health of every person living in Elkhart County. So that's kind of how we start our meetings and remind ourselves of our focus. I clearly see this job as a crossroads of politics, poverty, and medicine. So let me just outline for you 7 of the basic departments that function here in Elkhart County in the health department. One of our major efforts is in women, infant, and children. So we sponsor the feeding and the teaching and the education of every newborn mother, and particularly provide resources for those who have need for finances and other reasons. So we have several programs that have names associated with them. Healthy Beginnings is a program that helps young mothers and children get off to a good start. There's also a program called Healthy Babies. And then, as I mentioned earlier, the WIC program, which is Women, Infant, and Children, which is primarily a nutritional program. We have multiple other interventions in maternal child health. And one of the significant new efforts that's underway with significant grant money available through the state is our lead monitoring program. And our county does have a fairly significant lead issue, particularly in our rental units that are aging. And it's difficult to get our landlords to comply as the cost is somewhat prohibitive to remediate for lead. And if they do remediate, then they have to raise the rent. So you have this balance of public health agenda and community politics and economics all intertwined with the health of a young child. And lead poisoning in the young is a lifelong debility. So once you get it, you can't suddenly get rid of it as far as child intake. So we do the lead monitoring, we go in and do the lead inspecting, and if need be, we have to tell the landlord they have to remediate or close or prohibit from allowing children in the building. So that's one of the not so enjoyable aspects of the job, is enforcing some of our governmental and state mandates. We do a dental program for children that's primarily held out of the Elkhart offices there, and that's again for people who have limited to no income. We're involved in environmental health, as you may be well aware, doing groundwater assessments, septic tank inspections and approvals, which frequently gets us into trouble with the construction people in our community. There's nothing they like to hear worse than having bought a parcel of land and be told you can't build on it because the ground is unsatisfactory to build a septic tank. So that creates a lot of anger, a lot of misery. But again, that's an important part of the job of the health department. And in fact, we're engaged right now with a conservative Mennonite community south of town here that has quite a few properties that have been built without septic systems, who are over the last 20 or 30 years have been draining their septic into the fields, which, you know, if you've been doing it for 30 years and didn't have a problem, why do we need to now pay to fix that? So it's an interesting dynamic to deal with your own people and our own stubbornness, and I understand it. You know, the cost of trying to remediate a problem like that is quite significant, and these are not terribly wealthy community, but it is one of those issues that we are currently facing. And obviously, we do the food inspections, just having completed a significant work of the county 4-H county fair, where we have to inspect each of those vendors every day and to ensure that your health and safety takes place. We're also out at the Mennonite Relief Sale, again, ensuring all of those things. And if you've been parts of those endeavors, it's not always fun to see our inspectors show up and suggest things here or there. But that is an important part of our work that we do. We inspect all the restaurants here in town and all the food trucks that are in town, and that's created some challenges in the community, because there's a number of our minority, I guess they're not a minority as much as they used to be, have been comfortable serving food out of the home and selling that as a home-based product, and that also becomes a state regulated event and quite a bit of a challenge. If, you know, how dare you come in and tell me what I can and can't do in my own home. But again, if you're selling it and you're commercially advertising it, it falls under our obligation to inspect and approve and to make sure, and that's a challenge. We also inspect the public pools, make sure that they're run safely. So again, these are the health and safety of the environment, our environmental health that have state laws and state mandates that we have to do. We're involved in the emergency preparedness, so having to undergo training and preparation in the event of major disasters in the area. We step in to address the health-related challenges of floodwater and the contaminants associated there, or when our landfill catches on fire, as some of you may remember, the environmental concerns of that. We are significantly involved. So another major component of our endeavor is in the community health nursing aspect, where primarily we work with vaccinations and had a major role to play in COVID vaccination, both providing and ensuring we had enough vaccines in the area and then trying to figure out what areas to target. And as you're well aware, that also kind of put a target on our back as well, despite the fact that these mandates that were enacted were state regulated. The fact that we were having to enforce them at a local level became the target of certainly my predecessors, who, if you're not aware of those stories, is not a very pleasant and good part of our history here. So we're involved in working with the HIV population and do one of our most major clinic is in sexually transmitted diseases. We've been actively involved in the monkeypox issue and we in fact had one of the first cases in the state and continue to have significant efforts and do a fair bit of education and vaccination for that, which again are things that I had very little training in my experience, both personally or professionally. Another major role that we play is in vital records. So we record the births and miscarriages and deaths. And so that's probably the issue that I get the most number of, even though I'm a part-time worker, I need to be available pretty much 24/7, because if somebody needs to take the body out of state or out of country, they need my signature that there was no communicable disease or any relevant issue that would prohibit us from transporting that body. So that's something that usually needs to happen fairly quickly and needs to get taken care of. Nursing homes are eager to get that issue resolved. So that's where I have to respond fairly quickly. But it's an important part for our county. If you're changing your name or you need to prove who the father or the mother is, again, you need to go to vital records and you need to get these documentations and awareness. And the other aspect that we do in our county, the public health department is responsible for the sex education in all of our public schools. So we have a number of workers that go out and do that on a regular basis and provide that as an ongoing resource. So that's a fairly big contribution that these people have been doing for many years on your behest. And I think, as I've observed, one of the biggest challenges is this interaction between the politics and the mission that we have. As I've experienced and observed, it's a real challenge because very few of my people that we serve are voting members of this community, and a fair number of them are undocumented. And that creates a bit of a challenge of feeling like this is our responsibility to care for. Let me just give you a brief recent story. So we were contacted that there was a patient in our community who had active TB. And so once somebody has active TB, both they need to get treated right away, which are very expensive medications, and they need to be quarantined. And then you need to run around and find out who all they contacted. And so immediately we find out this is an undocumented individual. So he would not tell us any of his contacts because most of them were undocumented, and he wouldn't give us his address because, again, but he's been employed in this community for several years. So we had evidence of his employer, but we're not allowed legally to contact his employer because of the HIPAA requirements. So the nurses that were responsible for working gently and smoothly through this transition and trying to develop trust in an environment where rightfully so, there's very little that this individual could trust because the experience with ICE is quite quickly and for lots of reasons can come in and he can suddenly be deported. So it was a challenge. And just so that you're aware, government monies are, and this is not a local problem, I mean, this is a national problem, the same story. But there are monies aware that we were able to put him up in a local hotel to ensure that he would be quarantined. We provided all the medications until his test came back negative, which his sputum test needed to be negative for 2 weeks before he could be released back to work in the community. So you recognize immediately the dynamics that are at play here. You have a obligation to the community to protect them from individuals. You have a suspicious community that would love nothing better than to send people back to their home country, particularly if we're paying for their hotel room and but yet he's been actively employed in our community, so he's serving a vital role for the employer, which is one of the dynamics and the balances that we face in our community across the spectrum of responsibility and challenges. And let me just tell you another story that is in this politics and public health. So when we were on the verge of mandating vaccination, if you were an employer of over 100 people, you remember that was back in 2020, I think, where the federal government was suggesting that we mandate vaccinations so that we could get people vaccinated. We seem to have very little way of convincing the greater American society the value of vaccination. So it was on the verge of mandating vaccinations, that the employers would require that and the federal government would require it. So we were scrambling to set up vaccination units in all of the RV factories and stuff. And immediately the clients were coming and saying, what name should I use on my vaccination card? Because you needed to take a vaccination card to prove that you had been vaccinated. And so if they were getting vaccinated at the clinic, it was like, okay, what name do I put on the card? Do I use my real name so that do I use the name that I'm using at my work? Or use a different? So it created a bit of a challenge because it depended on who was going to use the card for what purpose and how it would be challenging. So, our staff was scrambling to try to figure out, okay, do we issue them 2 vaccination cards with 2 different names on it so that we can make sure that they get vaccinated and not have to worry about those small issues. But, the factories, when we went to the factories and asked them, what do you want? They said, we don't care. We don't care if they're vaccinated or not vaccinated. We're just trying to make the law and we'll take whatever they give us. So you recognize that these people are serving a pretty vital role in our community, whether we realize it or not, that the factory workers, the factory owners are aware and are just doing what they're trying to do, which is provide the cheapest RV that they can with the best quality workers that they can. So these are some of the unique challenges that come up in our day-to-day. The other challenge then becomes a little more dicey from a political point of view, and those of you remember the scenario of our health department applying for grants and getting significant grant money to take care of people who, for the most part, don't vote, and provide services for that community. And we're told we weren't allowed to get those grants. And in fact, that's a continuing ongoing struggle with our commissioners, is that, and rightfully so. I think if I was a commissioner, I would want to control all the purse strings and control all the decisions that are made. And the problem is the health department has a different mission and a different purpose and function. And historically, a fair bit of our funding came not through your taxes and through the things that the commission raises money for, but come through federal governments, through state government, through various benefactors, private and public funds. And this is how most health departments function around the country. And the more money we raise that isn't controlled by our local politicians, the more threatening we become. And I think COVID demonstrates what can happen if we become an entity that isn't controllable, is we can, create and follow mandates that can make the local community quite upset. And the challenge is, in this community, for some reason, we think that we can create our own rules and that we don't necessarily need to follow state regulations or national recommendations through national recognized scientific educated bodies like the CDC. And so that's creating a current dilemma for the people in our organization that are trying to follow what we consider appropriate standards and appropriate entities that we validate, and through our scientific model is not shared by a large percentage of our community in terms of the validity of their decisions and their assessment. So these are good challenges to try to figure out. I was reminded of our own particular Mennonite history. We're a pretty stubborn group of people, whether you know it or not, and we don't like to be told what to do by federal governments any more than anybody else does. A lot of our predecessors up and moved out of country, out of state, because we were told how to educate our children. We were told what we could and couldn't do with our bodies in one way or the other. So this is not a new endeavor, and it's certainly something that we ought to be sympathetic to this struggle, because it was far easier for many of our ancestors to up and just move to another country, to go to Paraguay, to go to Mexico, to, and be promised there for a while that we could do what we wanted, until slowly the rules changed. And that's, a government has a responsibility to protect all of us. We tend to think that we can do a pretty good job by ourselves and we don't really need the government. But unfortunately, there's a lot of people in our community that are vulnerable, and therefore we as a people need to figure out how to take care of that vulnerable aspect. And that's where public policy comes in, and some of the mandates that are issued, it's to try to protect and be aware of that. But it's created some interesting challenges and some new things that I've had to learn after what I thought were many years of having already learned it. I'm now relearning a lot of these things. And the monkeypox dilemma, just to create another scenario. I don't know how familiar you are with monkeypox, but it's primarily an issue with a subset of our populations whose sexual practices may be very different and very unfamiliar to yours. But here we are as a public health entity having to make strong recommendations about sexual health practices because the monkeypox is another scenario that creates this awkward dilemma of our public responsibility and our public generic risk that if we don't control something and get it under control, it can, in fact, be a much broader concern than just with a subset of sexually active young men. It tends to be the group that it's most prevalent in. And the concern is if you're having sexual encounters taking place in public restrooms and gas stations and lots of entities where many of these individuals, when we go and try to track down contacts, there's no way you can contact them because it's anonymous and it's far more frequent and creating a much quicker spread of risk if we can't get control of that. So that's an awkward dilemma. You know, what do you do in a country that prides itself in people being able to be independent and make their own choices, and we now have a public risk at stake, and so this is interesting. Education has been the venue primarily through which we've been trying to work at this, and fortunately that population is quite receptive to education. And whether they change behavior is a different matter, but they're well aware that this is a disease that is heavily affecting their community, just as HIV started in that same kind of community many, many years ago and created concerns. And let me just say in conclusion, before question and answer and other things, is getting back to what you heard from Susan Franger from their community assessment. Our community assessment, again, looking at a population that is primarily underfunded and lack of funded, is that one of the biggest needs in this county is taking care of our young Black mothers and their children. Our infant mortality rate in the Black population is about 10 times higher than the white population. And it's unconscionable when you think about that. And these are teenage mothers. It's multifactorial as we're trying to drill in and try to figure out how we make inroads in this. It's not just our community, but it's many, many communities across the country. So there is a built-in racism as a part of our medical system and as a part of our healthcare system that is creating this dilemma. And again, when you have young mothers with few advocates and few people working on their behalf and lack of finances, the babies are the ones who are paying the price. And that again is an embarrassing aspect, that our infant mortality is higher than a lot of third world countries in that population because of our own failures. So that's probably one of the overlaps that you might have heard from Susan is our effort in trying to make inroads into this challenge. So I think that's my rambling introduction of what I've experienced in a learning curve, which is far from my surgery background and far from anything related to cancer for the most part.
Thank you. Questions?
Yes, sir.
Well, Joyner, in regards to vital information that you collect, I have been reading that certain voices in medicine are saying that the sex of a child should not be recorded on a birth certificate. I wonder if this has been discussed in public health and what the current expectation is. Is there a determination of the sex which is recorded on birth certificates.
Well, I wish this was I could give you a public health answer, but it ends up being a state legislated answer, and therefore it's a political answer. So the question was, what does the role of vital records have in terms of documenting someone's sex of birth? And we have a number of people who've come in who have completed their sexual change and want to change their certificate, you know, because they are now no longer the sex that they were born with, and both medically and physically. And so that became a state mandated issue of how do we deal with that. So it'll be very interesting because this is not a medical issue. I mean, it could and should be a medical issue, but it has become a political issue. And therefore, I'm afraid that it's out of our hands and in this state of being able to change that. So it's an interesting challenge, again, of the crossroads of medicine and politics and religion. You know.
But currently, the report is on the birth certificate.
Yes, it is.
At birth.
It is at birth. And we are, even when it's ambiguous, as you know, there are some times where even a well-trained obstetrician can't always get it right. Or sometimes when you have both genitalia present. So but once it's established, it seems to be not able to be changed, is what I'm hearing. But those have been recent and active cases that we've had to work with in our area, and the state says we can't change it. Yes.
Do you have any challenges with the Amish communities?
The question was what our challenges is with the Amish community. Well, so COVID brought out a very peculiar scenario, right? The Amish were one of the first who rushed to make masks for the hospital, who were sewing gowns, who were, you know, when there were issues, they were all there jumping in. But when people started suggesting they wear them or use them, or then when things became mandated, they became the most obstinate and in fact, the least unvaccinated of any group in our community. And therefore it's created a risk to the rest of us, not with COVID necessarily, but if you refuse to get vaccinated for measles, for instance, and we have had measles outbreaks in the Amish community, that then puts the rest of us at risk because it allows these, what we thought were controlled diseases to reemerge because there's a large population that hasn't been protected or choosing not to get protected. So it is a unique challenge, and it also is a challenge because we have to interface with some of our laws and regulations about how you manage your farm and your food. And again, food regulation and inspecting becomes, and whether then you have to pasteurize your milk, for instance, and a number of entities are happy to try to sell things out of their barn without having to go through some. So these are real challenges. Then I think their community has been able to protect themselves from some of the government invasion, but it's a law, and our inspectors have to check that out too.
Talk about the interface between politics and the healthy concept, the healthy part of the. Do you see any path forward that would enhance the expectations of both commissioners and the health department on the common page?
So the question is what are the solutions, and where do we see hope lie in the interface of politics, and particularly our local politics with commissioners and elsewise? I would start by saying that 3 out of the 6 members of our board are Mennonites. If you look at the health officer position, It's been held by Mennonites for a large number of years. One of the more recent ones attends here. And Dan Nafziger was before her. So, and those of you may remember Stan Reedy held that many years ago. So I think, I do see there's hope. I mean, I meet with commissioners on a fairly regular basis. We have respect for one another. We have different things that are pulling us, making us obliged. They are people who care about our community just like we do. And I think it's our job to continue to be prophets in the community and say there's a lot of people who aren't voting who we have a responsibility towards. And again, that's a challenge of our nation. And it's a challenge that I think we need to continue to be advocates for, because like it or not, these undocumented people in our community are serving a pretty vital role to us. And we're all being advantaged by that. There's risks that come with that. Obviously, a lot of the hit and run accidents and a lot of the other health related concerns that become a part of this is because we haven't figured out a safe way to be together and to recognize each other's value. But I think there's hope and there's courage as you have people who want to continue to see from each other's point of view. And I don't think that happens easily without confrontation and without, being able to stand up and speak your mind. Yes, sir.
Can you comment on the issue of abortion and how it present or affects Elkhart County?
The question was how abortion affects or may implicate Elkhart County. I think we anticipate that because the state is moving quickly towards making that an impossibility for our residents, even going out of state, we anticipate that our maternal health and our maternal mortality will go up significantly as a result of that. Again, because you have a group of women who aren't getting appropriate care and are maybe seeking alternative ways to remedy their concerns or putting their lives at jeopardy and at risk. So we're anticipating that, again, trying to deal with education and jumping in and impacting young women in high schools and this high-risk group that it will be a challenge to try to work with them and to try to keep them safe and healthy and hopefully protect as many young babies as we can. So, but we don't have a specific plan other than our educational and our intervention. Once we're aware of their pregnancy, we can then step in with resources that again can support these women in a way that hopefully will keep them from making bad choices. So my last, yes.
How does things like measles and polio that haven't been around for years suddenly come back?
So the question was, how do measles and polio, which haven't been around for years, come back? The honest answer is due to a lot of the anti-vaccination efforts, a large group of people aren't protected and aren't vaccinated, so that when the virus does come, and in New York City, the reason polio came back is in many poorer countries, the kind of vaccine they use is a polio vaccine that has only been partially killed. So that the idea is to give you a low dose infection of polio that won't make you paralyzed and won't make you sick, but will be enough to rev your immune system up. So that virus is still partially alive. That individual came to this country and it's excreted in the urine or the feces, I forget which, but then becomes a part of our community environment and then somebody who's immunocompromised, who hasn't been vaccinated, the virus gains strength with additional infection, and then quickly you have the possibility of a virus taking place. And there's a large population of unimmunized people in New York City that allowed this seemingly to emerge. And that was true with a few years ago. That happened in our Amish population here, where measles, we had a fair significant, I think there were maybe 5 or 10 people, which is significant, but that, that can be a deadly disease as well. So it's a challenge, again, to try to work with people and keep them aware that we have some amazing medical abilities here, but there's a lot of competing conspiracy and mistrust that allows things that we thought were controlled to become uncontrollable again. Yes, ma'am.
We're needing to get another booster shot for the COVID. Will we be able to get that for free, or are we gonna have to pay for that now?
My understanding, it's still free. And the good news is the new boosters that are coming out here the middle or end of this month are in fact tailored towards the virus that we're all seeing in our community right now, which is the Omicron. So getting that booster will be a significant improvement, because even though we're not experiencing as much deadliness with this disease, with this current wave of COVID, it's very prevalent in our community, and we all know people who are getting it left and right, and unfortunately there's still people dying of it, and that's the sad part. But the vaccines still are the most effective way to protect yourself, and the newest vaccine appears to be going to be even more effective. So. Finally, I would say, please talk to any of your physician friends and colleagues, because my job is interim, and I said I would do it for 3 months, and that was back in January. So I'm desperately looking for somebody who has the passion and the experience and effort. And I say that seriously, because there are people in this community who could quickly do this job. I did it because they asked me the day before Christmas and they needed somebody January 1st, or the health department would close. And I thought, okay, well, that's silly. I go to South America all the time and do missions. Why in the world wouldn't I go 4 miles up the road from where I live? But I am ready to turn that fun responsibility over to someone else and create the challenge of the future.
Dr. Hostetter, thank you on behalf not only